What is LDH and why is it key for lymphoma prognosis? Imagine a tiny enzyme in your body that plays a big role in how your cells produce energy. That enzyme is called lactate dehydrogenase, or LDH. It helps convert lactate into pyruvate, a crucial step in how cells generate energy. When cells are healthy, LDH levels stay balanced. But when cells are damaged or destroyed, LDH leaks into the bloodstream, raising its levels. In lymphoma, especially non-Hodgkin lymphoma, measuring LDH gives doctors important clues about how the disease is behaving. Elevated LDH levels often mean there are many lymphoma cells breaking down, which indicates a larger tumor burden and more aggressive disease. This is especially true in aggressive types like diffuse large B-cell lymphoma. High LDH levels at diagnosis suggest the lymphoma is more active and may be harder to treat successfully. LDH is also a key part of the International Prognostic Index, a tool doctors use to estimate how well a patient might respond to treatment. When LDH levels are high, it raises the risk score, which generally points to a less favorable outlook. Monitoring LDH over time can help doctors see if the disease is progressing or if it might be coming back after treatment. If LDH levels stay high or start to rise again, it could signal that the lymphoma is worsening or relapsing, prompting further investigation. Very high LDH levels, more than double the normal upper limit, have been linked to a higher chance of lymphoma spreading to the central nervous system. This spread can make treatment more complicated and often indicates a more serious prognosis. Because LDH is involved in how cells metabolize energy, high levels can also reflect that the lymphoma cells are growing rapidly and adapting their metabolism to support their aggressive growth. Doctors routinely measure LDH during lymphoma staging because it helps them understand how extensive the disease is and how aggressive it might be. This information guides decisions about how intense the treatment should be and helps predict possible outcomes. However, it's important to remember that LDH is a nonspecific marker. Many other conditions like tissue damage, infections, or other illnesses can also raise LDH levels. That's why doctors interpret LDH results alongside other tests and clinical findings. In summary, LDH is a vital biomarker in non-Hodgkin lymphoma because it reflects tumor size, activity, and the likelihood of relapse. It helps doctors make more informed decisions about treatment and provides insight into the patient's prognosis. If you or someone you know is dealing with lymphoma, always consult healthcare professionals for personalized advice and care.